Hi and welcome back. Today I have a great lesson planned for you. We're going to go through an OET speaking roleplay test card, and I will have a patient, or a pretend patient but a real person, here in the room with me, and we're going to go over the OET roleplay card together. It does involve a patient who has been newly diagnosed with asthma. So I would recommend you watch until the end, because you're going to learn some great phrases, you're going to learn some great techniques, and you're going to leave feeling just a little bit more confident about how you can handle this task. Whether you're a nurse or a doctor, I will be playing the role of a nurse in this situation, but actually you could also transfer this to a medical role play as well. Okay, so the aim is, by the end of this today, you'll understand the format a little bit more. You will feel a little bit more confident about using opening phrases such as greetings and endings. And throughout the actual role play, you will learn some great phrasing, some good techniques that will all add to the marking criteria that will get you a good pass. Let's begin. Hello, Mrs. Cooper. How can I help you today?
So in this part of the test, we can see that the setting is in a suburban clinic. So this means that we may already know the patient and we are welcoming them because they are either coming back to see us again, or it could be that it's the first time they've come to us with this problem.
Hello, I've not been feeling too well recently. I had a bad flu. I'm very sort of short of breath and a bad throat and tickly cough.
Okay, and sorry to hear that. So how are you feeling now? A little bit better?
And then what we can see in this opening dialogue is that we can use phrases to show empathy, such as "I'm sorry to hear that," or "that must have been difficult for you." And this just encourages the patient to start giving us some more information about their symptoms as well.
A little bit, but it's the breathing, the shortness of breath is worrying me.
Okay, well, based on what you've told me, and I've had a little listen to your chest, I think you may have asthma.
Asthma? Oh.
Yeah, so what do you know about asthma?
Well, I've heard of it, and I think we've had some cases of it in my family. In fact, yes, we have, yes.
Yeah, okay. That's not surprising because it is an inherited condition. So some people find that they inherit it from their family.
Okay.
It's something that you can get a bit later in life. So obviously what we can do is manage it. It's not curable, but we can manage and control it. Asthma is an chronic inflammatory condition of the airways.
Right.
And sometimes you'll find that there's also a bit of a production of like mucus as well.
Yes, I do find that.
Yeah, so it can create a little bit of irritation and a little bit of tickliness when you're breathing, and then you need to cough and things like that. Okay, so that would explain your symptoms. Do you have any questions for me?
Well, what?
So what you will notice is that I've stopped after task 2 for a bit of a natural pause, just to follow any cue from the patient and to see if they want to ask me any questions.
What would we use to treat it then? What would I have to take?
Yes, that's a good question. So a common treatment is Ventolin.
Right.
Ventolin is a reliever inhaler. Okay. So it comes in a pump, and you take a couple of puffs to relieve your symptoms when you feel that you have tightness in your chest, for example. Okay, we start people with Ventolin. There are some other managements and treatments that we can provide if things get worse, but that's the common one we would start you with. How do you feel about that?
Well, that sounds okay, but are there side effects to this?
There can be some side effects. Common ones would include a fast racing pulse.
Right.
Some people find that can be more noticeable. You can get a dry throat sometimes as well. So, but the benefits outweigh the drawbacks in terms of side effects.
Okay.
Yeah.
Yeah, that sounds okay. Yeah, yeah. I mean, if it relieves the tightness, that's what I want.
Okay, good. So there are some other things you can try that might help. Some people find like inhalation works really well
Right. Okay.
to sort of open up the airways
Yeah.
and kind of give you some relief and some more sort of comfortable
Okay.
feeling.
Okay.
But yes, this is something that's long term. So as I mentioned before, we can't cure it, but we can manage it quite
Right.
effectively.
Okay. Okay, that sounds fine. Yeah. I'm just a bit anxious about it because I have heard that people can die from asthma attacks. Is that correct?
In a very severe case, it has been
Right.
known, but we have managed your symptoms quite early.
So, what you will notice is that the patient is very anxious, and it's a valid question. So, in a situation like this, we do have to be honest and we do have to prepare the patient for any eventuality. But at the same time, we have to balance it with reassurance that we have taken the right management course, that if the worst case does happen, this is what you should do. So it's a very careful balance of not avoiding the worst case scenario, but to do it very carefully.
Okay.
So what we would do is monitor you, and then obviously if you find that the Ventolin isn't working as well, we can step it up to another inhaler, which can work really well for you as well. Okay.
Okay.
If you ever did get a situation where you felt you couldn't breathe, you would dial 999 straight away.
Right. Okay.
But if your symptoms increase slightly and are more uncomfortable, then obviously you come back and see us straight away.
Okay, that sounds fine. Yeah. Okay, I'm quite happy with that then. I'll try the Ventolin and see how it goes.
Good. Okay, I'm glad to hear it. So we'll start you on that today. I would like to review you in a couple of weeks to see how you're getting on. And how does that sound?
That sounds fine. Thank you very much for your help today.
You're welcome. Please take care.
Thank you. Bye.
Bye-bye.
So finally, thanks for watching today. What you can always do as well, if you find you have about 20 seconds left at the end of the role play, I would recommend just doing a brief summary of what's already been discussed with the patient. And you can always end by saying thanks for coming, or I'll see you in a couple of weeks, or please do contact me if you have any other problems. It's as simple as that. Okay. If you do like, then please hit the like button and consider subscribing if you found it useful. Thank you.